So we would like to call the speakers up here to take a few questions and maybe have some discussion.
Again, we don't have a microphone, so if anybody wants to lead off with a question, welcome to hear it. Or if anybody at the table wants to lead off. It sounds like everything's difficult. Actually, it sounds like even TV ads didn't have a huge response in many of those countries.
Assisting? Okay. I think it comes down to the fact that there's very low level of awareness, very low level of awareness of what screening is all about, but also a low level of appreciation for preventative medicine. So, you know, the basic formula in the countries that I work in is you go to the doctor when you're sick, and usually only when you're very sick. That's been the tradition for since the fall of the Soviet Union, so for the last 22 years. Whereas I think the older people in the community have memories of the Soviet system, which was, you know, they were forced to go for screening. If you didn't go for screening, you weren't allowed to work, things like this. And so there's probably a reaction amongst older people, whereas a reaction against it. And amongst younger people, there's just no knowledge. So even if you send invitations, they just throw the invitation in the bin. So.
Yeah, I think the thing that's interesting here is all the challenges are so different in each area. Talking about areas with low resources or no resources and how you have to approach that. Here you've got areas that some of which have resources, but you have to be able to get the people involved. You have people on the border, and there's so many issues there. Certainly, along the U.S. side of the border, there are medical benefits that are usually available for most people unless they're there illegally, and then they have a hard time accessing benefits. But it seems like there's so many different challenges, and each one of these areas has its own challenges.
Tom, I think one of the things that is important to sort of recognize, regardless of where you're working, is that I think there's a profound degree of heterogeneity. Nubia's slides with the different provinces in Colombia, I think, are a good example of how much heterogeneity there is in terms of the manifestation of HPV-related disease. We see the same thing in the U.S. We see the same thing in Arizona in particular. And so that when you're trying to develop population-based approaches to the prevention of this type of disease, it's hard to come up with a one-size-fits-all solution. What works for us in the Indian reservation is not going to work for us in a border community. What works for us with a rural, indigent white population is not going to work for us with an inner-city African-American population. So I think that heterogeneity is part of the reason why we have some real challenges, and part of the reason why, unless we really do a better job of organizing services, we will continue to have this residual amount of needless cervical cancer cases and cervical cancer deaths, even in developed nations.
I guess everybody that's been here all day is probably ready to go, unless we have